Well, it's limited. The responsibility for training rests with member states, and they lay down their curriculum and their monitoring and their disciplinary procedures, and that's right, and that will go on being the case. When we were looking at cross-border health, we were very clear that the responsibility for the good practice and the people to whom you would turn if there had been less than good practice is the responsible authorities in the member state in which the professional is based. So it is undoubtedly for that member state to make that provision. What I think the European Union institutions can do is to encourage the not only effective cross-border contact and an understanding of what the standards you can expect are. That's important. But they can make sure that we have high standards when it comes to health professionals travelling and working in other member states. And I think that's the key. And it will allow, of course, member states, and sometimes we don't do things, but we allow member states to do them. It will allow them to require things like adequate language standards to be a requirement for somebody to practice in your country. That may seem an obvious point, but it's not always, doesn't always happen. And we had a case in my country not so long ago where somebody was badly hurt because the doctor rang the ambulance service to call for transport to the hospital and said the patient was sleeping when he meant the patient was unconscious. The ambulance service didn't think there was the urgency, but obviously there was. And so language is actually quite important. And it's, the more we can do to help in language training is something we can do for professionals, not just health incidentally, it applies as much to architects and so on who are going to build our houses. But for the health professional, I think it's supremely the responsibility of member states, but the EU can add value and add standard to that.